Namaskara. I'm Dr. Vinod from Samprada Cancer Hospital. In continuation with our earlier videos, we want to discuss about the comorbid conditions of diabetes and hypertension with cancer. So evidence talks about how diabetes leads to cancer because of high blood sugar levels, which eventually causes cancer, but cancer itself is an inflammatory condition and it can give rise to diabetes. So the incidence of diabetes is maybe 4 to 6 times higher among cancer patients when compared with the general population. So what happens is that obesity kind of leads to an inflammatory state. An inflammatory state is marked by a few markers. They're called as TNF alpha, they're called as interleukin 6. So most of them are clubbed together as cytokines, and these cytokines create some sort of a metabolic processes wherein the C-reactive protein, which is the most commonly measured biomarker, that is increased. And the C-reactive protein has an effect on the insulin levels. So it increases the insulin levels, or what we call as hyperinsulinemia, and that could be because of insulin resistance, because you need insulin for the glucose uptake in the tissues. So hyperinsulinemia by itself can increase some other byproducts called as IGF, that is insulin growth factor 1. So in a sense that diabetes leads to cancer, and cancer can increase the incidence of diabetes among cancer patients. So here at Samprada, we have a method by which we regularly monitor the blood glucose levels, and maybe because of cancer, maybe because of stress, or maybe because of steroids, if the diabetes onset is there, we tend to detect it at an early stage, and then we manage the glucose load in the body. Now, it's also important to look at the inflammatory markers, because inflammation happens to be creates a fertile bed for many of the non-communicable diseases. Not just cancer, but mental health also, connective tissue disorders, hypertension, diabetes, as we all know, lipid disorders. We are all welcoming, or in the sense of waking up to the concept of metabolic syndrome. So it has a combination of all of these things. So when we have a cancer patient, it's not just the biology of cancer that we are treating. We are also looking at many other issues, comorbid conditions, the general nutritional state, the mental health, as well as the comorbid conditions such as diabetes and hypertension. There's a lot of anecdotal data which talks about hypertension in cancer, and then there's a hypothesis that hypertension automatically improves to an extent that they may have some patients may be off antihypertensive medication by the time they complete cancer treatment. Now, how the cytokines which are coordinating or mediating the inflammation in cancer kind of have an influence on diabetes and hypertension, we need to have more longitudinal studies and come up with more solid data. But by the expert opinion, we hear about their experiences, and we find that cancer increases the incidence of diabetes. Cancer has the potential to reduce the incidence of hypertension, and it might worsen the lipid abnormalities. So we have a method by which we periodically monitor the biomarkers related to each of these conditions. So in a gist, it's not just the cancer biology that we need to look at. We need to look at the patient as a whole, and this becomes the crux of our discussion today. So thank you very much for the opportunity.